Hi, I'm Sarah Karstens, a licensed clinical social worker and clinical director of addiction services at Princeton Health Behavioral Health. When it comes to depression and addiction, it can be hard to know which came first. In fact, when patients come to Princeton House, they often say they are not sure if they're drinking to soften the pain of their depression and fortify themselves to deal with the world, or whether drinking was actually causing them to be depressed. In treatment, we address both at the same time because people need help to cope with both. A dual diagnosis, also known as a co-occurring disorder, happens when a person has a specific combination of diagnoses at the same time, both a mental health condition, such as depression, and a substance use disorder. Dual diagnosis is not an exception. It's more common than you might think. According to the National Alliance on Mental Illness, or NAMI, of the 21 million people in the U.S. who have a substance use disorder, 8 million also live with a mental illness. It can be difficult to diagnose because one disorder can mask or heighten the symptoms of the other. NAMI reports that about a third of all people experiencing mental illnesses and about half of the people living with severe mental illnesses also experience substance abuse. The organization also reports that men are more likely to develop a co-occurring disorder than women. Other people who have a particularly high risk of dual diagnosis include individuals of lower socioeconomic status, military veterans, and people with chronic medical conditions. We all go through challenging times, periods of sadness, or significant life changes. But when you experience these and they make you feel overwhelmed, unable to cope, or if you have a family history of depression and/or addiction, it may be time to seek professional help. The key is to identify whether your feelings and behaviors are impacting your daily life, relationships, work, or school activities. Things to be aware of include intense hopelessness, an overwhelming sense of worry or dread, increased isolation or withdrawal from family and friends, significant changes to sleep patterns and/or eating habits, increased irritability or anger, hiding your use of alcohol, medication, or drugs from loved ones. It's also important to be aware that the symptoms of a mental health condition can vary greatly. Understanding the warning signs, such as extreme mood changes, confused thinking, or problems concentrating, avoiding friends and social activities, and thoughts of suicide can help identify if there is a reason to seek help. The first step in treatment for a dual diagnosis is to help the individual understand the interplay between depression and substance use to help begin the process of breaking the cycle. Someone may be dealing with depression by drinking, for example, and that behavior may lead them to retreat further from family and friends, which then increases their isolation and results in deeper depression. Dual diagnosis treatment at Princeton House helps individuals work through the process of understanding this interplay and then helps them develop the skills needed to cope with their depression and substance use. Dialectical behavior therapy, or DBT, is a type of therapy offered at Princeton House that can help people learn to regulate their emotions, tolerate distress and uncomfortable feelings, and interact effectively with others. Both inpatient and outpatient treatment programs at Princeton House include learning and applying DBT skills in a combination of group and individual therapy, as well as family support sessions. Inpatient treatment will typically last 5 to 7 days, with the recommendation for ongoing treatment in the outpatient setting upon discharge. A course of treatment at Princeton House outpatient centers is generally 6 to 8 weeks. Our treatment team works with patients to set up an aftercare plan prior to completing the outpatient program. Including family and loved ones in the process is important. They play an integral part in a person's success. It's important to remember that no two people are the same. Everyone has different goals for treatment. At Princeton House, our objective is to help individuals identify and achieve their goals. After completing a dual diagnosis program, many patients share that they feel more capable of managing life stressors, have better control over their mental health symptoms and substance use, and experience an improved quality of life. If you or someone you love is experiencing both mental health and substance use challenges, help is available. It's important to work with trained professionals who can be sure that you receive an accurate diagnosis and can create a treatment plan that addresses your specific needs.